So Dr. Gilroyd, we talked a little bit about the link between alcohol, tobacco, and acute pancreatitis. And can you discuss what the link is between alcohol, tobacco, and chronic pancreatitis?
That's a very good question. It's a very complex question. And I think that lately we're starting to read more and more in the medical literature, the link between heavy alcohol use and heavy tobacco use. And in general, we tend to say that somebody's drinking in excess when they're drinking 5 alcoholic beverages per day, and that would put definitely the patient at risk of developing chronic pancreatitis. The link also, it's related to some type of underlying genetic predisposition that will make the pancreas of this patient more susceptible of injury than the other patient that may not have any type of genetic predisposition or something else that we may still don't know what it is. The problem with alcohol is that when we see the way that alcohol affects the pancreas, actually when you see it under a microscope, you can see that alcohol has a very direct effect over the cells in the pancreas. So when you're doing this in excess every single day, a subset of patients, their pancreas may give up and get sick and get the condition. An interesting point also is that frequently patients that are drinking in excess or smoking in excess or smoking at all, that also has a bad effect over the pancreas. In early stages, when they develop the initial episode of pancreatitis, if they stop, the disease may stop and never progress to chronic pancreatitis. The problem is that a subset of patients, a group of patients, may continue to drink excessively, may continue to smoke excessively, which actually frequently they go hand in hand, and the disease will continue to progress until they develop the full chronic pancreatitis. So we know there's a link, but we don't know exactly why some patients develop the full-blown disease and why some others don't. What we know is that if you have any type of pancreatic condition and you're drinking in excess or smoking, you must stop.
I think that's a great point that you made about the alcohol and tobacco. I think in someone who has chronic pancreatitis, it's really important for them to know that if they are drinking to excess, and certainly if they're smoking, stopping that activity really could make a big difference as far as their disease and how it progresses.